Hello, everybody. Dr. Dominic here, Elite Facial Plastic Surgery in Tampa, Florida. One of the topics that often patients ask me is the recovery after rhinoplasty. Now, whether it's a cosmetic rhinoplasty or a functional rhinoplasty, they're usually about the same. Most patients, regardless of what rhinoplasty you have, we normally tell patients, as a rule of thumb, to give your nose a good 9 to 12 months to fully heal and settle out. Now, leading up to that, there are going to be more recovery periods. So as a rule of thumb, after you have your surgery, you normally will follow up with your surgeon, usually about 5 to 7 days later. At that follow-up visit, you'll have the external splint removed. If you happen to have internal nasal splints, those will be removed as well. We normally also suction out any dressing that could be in the nose as well. We'll also remove the sutures that come across what's called the columella here if you have an external approach. If you do have an external approach, you're going to have about 5 sutures that need to come out. The other sutures are normally absorbable. After that first post-op visit, you'll typically follow back up about a week later for your 2-week follow-up. If you're doing well, I typically will have you come back 2 weeks after that for a 1 month. And then if things are going well and you don't have any questions or concerns, I normally have you come back 2 months later for a 3-month follow-up. And then normally I'll see you back anywhere from your 4 months to 6 months, and then normally 9 and 12. Now, if patients are super happy with nose, everything's going smoothly, then some patients, can adjust their follow-up times. It really just depends. Some patients like to be seen more often to make sure that the swelling is normal. That's one of the biggest things that patients need reassurance about is the swelling. Because unfortunately, we live in a day and age where we want things now and want things to be done and healed quickly. But when it comes to the nose, and especially in rhinoplasty, it takes a lot of time for things to settle out. And a lot of the component that takes time to settle out is the lower part of the nose, the tip. And a lot of it has to do with gravity. It also has to do with there's a lot of cartilage and soft tissue that takes time to fully settle and scar. The dorsum here in this area will also take a little bit of time as well. And a lot of it depends upon how large of a dorsal hump you have. Now, a big part of the healing or the recovery part is that first 2 weeks. And the reason why is if you have swelling, it takes time for that to settle. And that's the acute swelling where people's eyes would be swollen, for instance. The other component to this is bruising. If you do have any bruising, it normally goes away by 2 weeks. And bruising, will settle out just like it normally does. Initially to black and blue, and then it slowly graduates and becomes more of a bronze color, and then it fades away. And that usually takes about 2 weeks. In some instances, though, you can have a little lagging bruising, and it's normally right here underneath the eyes. But most patients, can get back to the gym working out within about 2 weeks. But again, if you have any questions, any comments, feel free to let us know at the end of this video.